And Health Manager UNICEF, Peter Baffoe, joins me on the news. Good to have you join us, Peter Baffoe. It is no-brainer that this COVID-19 pandemic has come to expose how the weakness of most healthcare systems in the world. Now, what is your assessment of Nigeria's child and maternal health care, especially in line with the Sustainable Development Goals?
Right. Thank you very much for the opportunity to speak to your listeners on this subject in this important day. Now, we know that most health systems across the globe, especially in the developing world, have suffered significantly due to the COVID pandemic. We are all trying to address the pandemic whilst at the same time sustaining essential health services, especially focusing on vulnerable people. And Nigeria has done well its bit to ensure that the pandemic is controlled and at the same time maintain the basic essential health services that vulnerable people, like especially women, children, will need to sustain the barest minimum of health that is required.
And we know that the rural communities in Nigeria account for the high rate of maternal and child mortality in the country. What level of community engagement do you think that the federal government should begin to put in place, especially in this time of COVID-19, if we were to reduce the rate of maternal and child mortality?
Yes, I mean, the very concept of health requires that we create a fairer society so that the most vulnerable in our society can also attain the barest minimum of standards that is required. And when we talk about vulnerable people, we refer to women, children, poor people, people who live in hard-to-reach communities that are difficult to reach with our health interventions. And in this regard, we know that even before the pandemic came, the government has the CHIPS program, which is basically aimed at reaching out people who otherwise, without these community interventions, wouldn't be reached for essential health services. Outreach services have also been used to reach people. And even if you look at the way vaccine deployment has been organized against the pandemic, this government and agencies and all partners have ensured that all states and all LGAs have access to vaccines so that they can also be protected irrespective of wherever they live.
And as the COVID-19 pandemic continues, we hope that we'll find ways to deal with other infections and other diseases without having to lose more people. Health Manager UNICEF, Peter Baffoe, thanks for talking to us.
Thank you for having me.